Great Friday morning to everyone. Today is the second and the last day of the fourth Environmental and Occupational Health Forum. I am Rose Abigail Duarte. You can refer to me as Abby Duarte. I'm an assistant professor, and on behalf of the Department of Environmental and Occupational Health, College of Public Health, University of the Philippines, Manila, let me welcome you back if you attended yesterday. But for those who are attending for the first time today, welcome to the EOH Forum. And our theme is Building Back Better, Resilient EOH Systems for the Next Global Crisis. We are privileged to share this second virtual offering with all of you. We welcome all our guests and friends, those who are participating from abroad, and all of our guests who are very special to us. So please take note that the forum is currently being live streamed through YouTube. So in case you get disconnected and in the unfortunate event that you are unable to reconnect to the meeting, you may still participate in the forum via YouTube by accessing the link shared to your registered emails already. And you may also accomplish the evaluation forms and the post-test to get a certificate. The links to the said forms will be shared by our staff through the Zoom, and it will be emailed immediately to you after the event. Now, we hope that yesterday's sessions helped us and made us reflect on how the COVID-19 pandemic changed the way we live and do things, and eventually how this public health concern is preparing us for the next global crisis. Now, to give us the highlights of yesterday's proceedings, let us welcome back our Master of Ceremonies for Day 1, Dr. Vivian Fe Fadrilan Camacho. Doc B, over to you.
Good morning, everyone. Thank you, Professor Duarte. I am tasked to give a recap on what we discussed yesterday. First, we had, of course, UP Manila Chancellor Carmencita Padilla welcoming the participants and the speakers to the forum. She was pleased to have experts in the field of EOH from different organizations. She highlighted that the forum discourses would center on efforts to bring back resilient environmental and occupational health systems that were gravely affected by the pandemic. She looked forward to the active engagement of stakeholders in influencing EOH policies, programs, and services, especially during the pandemic and the new normal. She hoped to learn lessons from a variety of narratives tackling relevant environmental and occupational health issues, resulting to initiatives and collaborations that promise a better outlook for EOH with or without a crisis. Next, we had our UP College of Public Health, Dean Vicente Y. Belisario Jr., to give his opening remarks. He mentioned that the forum theme, Building Back Better, Resilient EOH Systems for the Next Global Crisis, is fitting amidst the pandemic and beyond. He highlighted the need to prepare for the next global crisis through sustainable interventions using systems approach with the building blocks of EOH. He encouraged everyone to recalibrate our plans and efforts in line with the EOH goals during these challenging times. He also reminded us that the end date for these sustainable development goals is upon us, and we need to continue to align our efforts and to achieve them amidst these disruptions in the delivery of health services. And finally, he commended the department for organizing this relevant forum. Next, we had the opening lectures on environmental and occupational health systems before and during the pandemic, local and international perspectives. Our first speaker was Dr. Mushtaq Ahmed Memon of the United Nations Environment Program, Regional Office for Asia and the Pacific, who tackled EOH systems before and during the pandemic experiences of countries. He discussed plastic pollution and marine plastics abatement during the pandemic. He reiterated that pollution is one of the most challenging problems in public health. He added that the Asia Pacific fell behind in achieving its SDG targets, especially life below water and on land. Plastic waste before the pandemic was already a serious problem. He mentioned that we are consuming and disposing plastic, which continuously affects the environment and public health. During the pandemic, personal protective equipment or PPEs, products which make use of plastics in medical packaging, contribute to the increase of plastic wastes. There is a need to examine our current policies and programs to help address the increasing plastic waste in the environment. It is imperative that we put our act together to reduce plastic waste, especially the medical sector. He mentioned that there is a need to create bigger solutions, meaningful actions that start with innovation, strategic financing and investments, planning, monitoring, and evaluation. Finally, Dr. Memon emphasized the importance of awareness raising by educating people on practical ways to engage the consumers in ditching disposables, promoting new consumer habits, and engaging all stakeholders. Next, we heard Dr. Maria Rosario Singh Vergere from the Department of Health, who discussed EOH systems before and during the pandemic, the Philippine scenario. She delivered her talk via a pre-recorded video. She was grateful for this event as it paved the way for her to share with us the DOH initiatives for environmental and occupational health before and during the pandemic. She discussed how the pandemic has worsened existing environmental and occupational health problems. She also added how DOH is still facing challenges in responding effectively to the crisis. She discussed major
Okay, we're sorry about that. I think Dr. Camacho got disconnected. So while we're waiting for her to reconnect, no, let's spend a few minutes. And okay, those were the highlights of yesterday. But today we're looking forward to a different set of speakers, and we'll be focusing a bit more on the occupational health side of this forum. Okay, so um, may I check if Doc Bing is already back? Okay, I'm going over the list. Okay, unfortunately, she is encountering some technical difficulties, but Doc PM is here to share with us some highlights as well. Dr. Hernandez.
All right, thank you, Prof. Abby. So allow me to continue the sharings by Dr. Camacho. So after Dr. Memon's discussion on plastic pollution and how we should address this, we heard from Dr. Maria Rosario Singh Vergere from the Department of Health, who discussed EOH systems before and during the pandemic, the Philippine scenario. So she gave her presentation through a pre-recorded video, and she added that she was grateful for the event as it paved the way for her to share with the audience the DOH initiatives for EOH before and during the pandemic. In terms of environmental and occupational health problems, she discussed how the pandemic has worsened such challenges, and how the Philippine Department of Health is still facing these challenges in responding effectively to the crisis. In terms of EOH programs, she highlighted a few, which are as follows: food safety, public health standards in workplaces, air quality, climate change, zero defecation, waste management with special mention of infectious waste due to the increase in the use of PPEs. She also emphasized the need for capacitating the health sector in strengthening its efforts to address EOH issues such as climate change. Also included in her discussion are the provisions for occupational health and safety measures at the national level as a response to the new normal. Dr. Singh Verhere also emphasized the need to be guided by evidence-based public health measures to continually address the existing challenges brought about by the COVID-19 pandemic. She concluded with her statement that the Philippine Department of Health tries its best to strive to help the nation build back better to move past this global crisis. After the opening lectures, we had the first panel discussion with the first speaker was Attorney Glinda Bathan Baterina from Clean Air Asia. Her presentation focused on ensuring good air quality in communities. Attorney Baterina shared how majority of people in the world are breathing unsafe air. She added that across 419 cities in the region, more than 90% are at risk due to the high level of particulate matter in the air. She further elaborated that how air pollution affects all parts of the body, resulting to adverse health outcomes such as morbidity and premature mortality. She emphasized that safe air is a basic human right, and due to the pandemic, we had lockdowns, and then there was a noticeable drop in air quality indices. So there was improvement in air quality, but unfortunately, when the restrictions were lifted, there was again a resurgence of air pollutants, which led to challenges, particularly for healthcare. Attorney Bathan Baterina proceeded with discussing the health and economic benefits by reducing PM 2.5 levels in the air. She also reiterated the cities are at the front lines of the fight for air quality, and there should be strong science-based air action plan and multisectoral collaboration for us to achieve good air quality. She concluded her presentation by encouraging everyone to work together to achieve this goal. The next speaker for the panel discussion was Mr. Ramon San Pascual from Healthcare Without Harm Southeast Asia, who discussed promoting green initiatives for the healthcare sector. Mr. San Pascual highlighted that 4.4% of global net emissions of carbon dioxide is from healthcare. Unfortunately, it's unfortunate that that the Philippines is the fifth biggest nation polluter in the planet, which is particularly alarming for us. He discussed the global roadmap for healthcare decarbonization that is intended as a navigation tool for promoting health equity and achieving zero emission while being climate resilient. He reiterated that the Philippines is one of the most vulnerable to climate events. And he added how the healthcare industry can take up actions in an organized, systematic manner to lower carbon emissions. Mr. San Pascual added that for us to address healthcare emission gaps, we need it cannot be business as usual. We need to align ourselves with countries and sectors that made the commitment to address climate change. He proceeded with discussing pathways to create zero emission by decarbonization of healthcare facilities and operations as well as the supply chains. Towards the end of his presentation, he shared some examples of green initiatives among healthcare facilities. And he concluded his lecture by mentioning that his organization continues its advocacy to address climate change by raising awareness and building capacity to plan and implement these green initiatives. So these were the highlights of day one as developed by Dr. Vivian Fadrilan Camacho. So we hope everyone enjoyed the sessions as much as we did. Back to you, Professor Abby Duarte.
Thank you so much, Dr. Hernandez and Dr. Camacho, for sharing those highlights. We sure were able to accomplish a lot yesterday. Today's session will be a bit shorter, but it will focus and it will tackle equally important issues. And now we would like to commemorate this event. And with that, we'd like to invite our organizers and the speakers who are already here to turn on their cameras, please, so we can document this event. And I'd like to request our screen manager to guide us while taking the photos. To cue us, please.
Okay, get ready po. On three. 1, 2, 3, smile. Okay, one more. 1, 2, 3, smile. Thank you very much. You may now turn off your cameras.
Thank you so much, Heidi. So while our participants unfortunately are not able to join us in that documentation, you are requested to post a selfie while attending this forum, and you may use 3 hashtags. It's hashtag 4th EOH forum, hashtag building back better, and hashtag we are CPH. So we value your feedback about this event. And we ask you please to accomplish the evaluation forms later. And the link for the day to evaluation form will be shared by our staff. For the audience here in Zoom or those watching our live stream, if you want to receive a certificate of attendance, please ensure that you accomplish those evaluation forms for day 1 and day 2, as well as the post-test. Yes, we have a post-test. And the link for the post-test will be shared by our staff later. These will also be emailed to the registrants immediately after the event. And you have only until 3 o'clock this afternoon to accomplish those forms. All right. So let's take social media by storm. Thank you so much again to those who gave the highlights yesterday. And we're now excited to proceed to what we have this morning. And we have 3 distinguished speakers who will share their thoughts on OH issues that are pressing and that are relevant. We will have the second panel discussion and the concluding lecture today. This session or this panel discussion is titled Advocating for Psychosocial Wellness and COVID-19 Vaccination in Workplaces and Communities. Facilitating the discussion is our third moderator. Let me introduce him to you. Dr. Victorio B. Molina is a professor of environmental and occupational health, CPH, UP Manila. His public health career started with more than 10 years of environmental health work in the Philippine Department of Health before joining the College of Public Health in 1998. He was a former department chair and assistant to the Dean for Planning and Development of the College of Public Health, concurrently serving as the Deputy Center Director of Simiotropmed Philippines. He holds 2 degrees in engineering, in civil engineering and environmental and sanitary engineering, licensed to practice both professions in the Philippines. He also earned his Master of Public Health degree from UP Manila and his PhD in Environmental Science from UP Los Baños. His research and public service work have been shared in local and international journals, mostly in the areas of water, sanitation, and hygiene, health risk assessment, air pollution, management of healthcare, waste, and hazardous substances. He also provides technical assistance to government agencies, industry, non-government organizations on various aspects of environmental and occupational health. One of his main advocacies is to promote environmental health in the Philippines and in the Asia-Pacific region as an important contribution to the attainment of the United Nations Sustainable Development Goals. I am now pleased to turn over the virtual floor to our moderator, Dr. Vic Molina. Dr. Vic, over to you po.
Okay. Thank you, Professor Abby Duarte. Good morning, everyone. Welcome to the second panel discussion, Advocating for Psychosocial Wellness and COVID-19 Vaccination in Workplaces and Communities. We would like to gently remind our speakers that they are given 20 minutes each to share their thoughts on this topic. Messages will be sent to them via Zoom chat box to remind them of the time remaining. Our first speaker is Dr. Jason Ligot. Dr. Ligot is a public health doctor and international health promotion specialist experience working in health promotion, mental health, tobacco control, non-communicable diseases, for local and international health organizations, national government agencies, non-government organizations, civil society, and educational institutions. These projects include convening high-level conferences, conducting workshops, and overseeing multi-country communication and advocacy campaigns. He has also edited scientific articles on health promotion, health literacy, and communications. Last year, 2020, he co-founded #Protect the Frontline, a community campaign to mobilize equipment for COVID-19 frontliners. Dr. Ligot holds degrees in psychology, medicine, and public health, graduating with distinction. He earned his Doctor of Medicine degree from the University Ramon Magsaysay Memorial Medical Center and his Master of Public Health degree from the College of Public Health, University of the Philippines, Manila. To learn more about creating environments for wellness, let us all listen to Dr. Jason Ligot. Dr. Ligot, the virtual floor is yours.
Thank you so much, Dr. Molina, and thank you everybody for joining us this morning. My thanks to my alma mater, UPCPH, for this very gracious invitation to speak with you and share with you some thoughts and perspectives on how do we build back better to promote psychosocial well-being. So I'll be going through over the next 20 minutes, I'll be sharing with you just some information that we've been talking about over at the WHO also, and maybe sharing some perspectives that will be relevant to the theme of our forum today. So my area of expertise is in health promotion, and whenever I'm asked to speak about the work that we do and what we should be doing moving forward, I always like to circle back first on the definition of health offered by the WHO way back in 1946. Now, for those of us who are working in public health, this definition is very familiar, and it goes as follows: that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. So this is way back in the 40s, and even back then, the WHO already recognized the importance of our mental and social health, and really going beyond just disease or infirmity when it comes to defining whether or not we're healthy and highlighting the value of well-being. Now, the WHO also offers a definition of mental health, and it's actually quite functional, covering the following domains: our potential, resilience, productivity, community. So when we're promoting mental health or promoting psychosocial well-being, I think it's important for us to go back to this definition as well, so that we have an idea what exactly it is that we're promoting. And mental health first is about potential. It is a positive force that allows us to realize our own abilities, to apply our skills and talents in meaningful ways that give us satisfaction and allow us to pursue our goals. It is also about resilience, and that is actually the topic of this forum. And certainly our resilience has been tested over the past 1.5 years with this pandemic, and continues to be tested because the pandemic is not yet over. It continues to evolve. And so our ability to cope with the normal stresses of life is constantly under threat because of COVID-19. And we need mental health to keep us sturdy and resilient amidst all of this uncertainty. It's also about productivity, and I think we can all relate to that, of course, especially now that we've had to adopt new ways of working, new ways of communicating with each other. If were it not for the pandemic, we would probably be meeting in person in a physical venue, But now we have to adopt all of these digital tools for us to remain productive. And finally, mental health is not just about individuals. In fact, it's really about communities and our ability to make a contribution to the communities in our lives, whether that's our immediate families, our wider social circles, our friends, our colleagues at work, and even these virtual communities that we're forming right now. We are one community this morning talking about and learning more about environmental and occupational health. Now, what has been the psychosocial impact of COVID-19? Very early on, and this is from a policy brief that was issued by the UN on COVID-19 and the need for action on mental health, the United Nations and the WHO already recognized that mental health and psychosocial well-being will be a defining feature of this pandemic. Good mental health is critical to the functioning of society in the best of times, but in the worst of times, and we've certainly gone through very difficult times the past few months, it must be front and center of every country's response to, and I highlight, recovery from the COVID-19 pandemic. So we like to say that mental health should not be seen in isolation. It should be part and integrated into our general discourse about the pandemic. And here is some early data about the impact of the pandemic on psychosocial well-being. And as you will appreciate, much of this early data actually came from those early hotspots in China, Italy, and Spain. Now, what has been the impact of the psychosocial impact of the pandemic on certain populations? It's been difficult for our healthcare workers. Some of you here may be frontline workers yourselves. And we know how hard it has been, especially during the times during the surge when our hospitals were overwhelmed and a lot of people were trying to seek help. And our healthcare workers were trying to cope with an incredible increase in demand for services under very difficult conditions. So not surprisingly, when we did a systematic review of different studies that were carried out, we found that mood, sleep disturbance, distress was actually pretty common among our healthcare workers. As many as 21%, 1 out of 5, had depression, anxiety. Even more, 1 out of 3 had problems sleeping and experienced mental distress. The higher risks of difficulties were associated, of course, with those who had to directly provide care for COVID-19 patients. So healthcare workers, for example, who are assigned in critical care units or COVID-19 wards. The fear of infection, the fear of bringing the infection back home to their own loved ones was a major driver of a lot of distress. We also observed that among women healthcare workers, there were higher levels of prevalence of anxiety and depression. And even our non-medical, but still very important members of the general staff, the prevalence of anxiety actually doubled. It's also been difficult for the mental health of our young people. And one of the key, I think, points to make here is the disruption in education has been particularly concerning. So it's good, for example, that at least here in the Philippines, we've started to pilot face-to-face classes already, but the disruption in regular schooling has been very difficult for many young people. Primarily because school, apart from giving them a sense of purpose and a routine, is really an important source of psychosocial support for many of them. And now they are physically separated from their peers, their friends. They're unable to bond, to create all of these very important developmental milestones that are critical to their development as people. And really, how easy or how I don't think it's difficult to imagine how hard it is to study and to apply yourself under these very difficult circumstances, studying from home while also probably fulfilling other chores at home as well. And mental health, the psychosocial impact of COVID-19 has also been very difficult among our older adults. These are our parents, our grandparents, our senior relatives, our senior colleagues. Many of them to this day remain quite isolated because of fears of infection. And one of the early papers that came out actually that examined this phenomenon actually was published from the Philippines, and they identified the following risk factors for poor mental health: being lonely and isolated, unmet spiritual needs. If you remember, at the beginning of the pandemic, there were, but it wasn't common practice to attend mass and other religious services online. And this is an important source of support for many of our senior citizens. Poor physical and social well-being. So for many of them, their baseline health was already compromised before the pandemic, and the pandemic just made it worse. And a lot of depression, anxiety, and fears of dying alone were driving this. So in terms of services, we also saw that there was a lot of disruption in the provision of mental health services. And this is some data that was taken from a global survey carried out by WHO, examining what has been the impact of the pandemic on service delivery. And the greatest disruption we've observed is the community-based activities and services for vulnerable groups. Precisely the groups that I highlighted earlier that were experiencing higher levels of stress and fatigue. So interventions for caregivers, school mental health programs, home or community outreach services, services for children and adults. These are some of the very common services that were disrupted. Almost 50 to 60% of countries who responded to this survey said that these services were severely disrupted. So you have a situation where a lot of people are feeling anxious and afraid because of the pandemic, because of the environment that we are in. We're constantly barraged in the media with all of these fear messaging and a lot of misinformation as well. And at the same time, the services that you used to rely on, going to the hospital, for example, making an appointment with your doctor, seeing your friends in school or at church, all of this were deprived. So it's really been a very difficult time for all. And how have we tried to respond? Telemedicine was the most frequently reported strategy to overcome service disruption. So a lot of countries have switched, or a lot of service providers have switched to providing services online or expanded their online service provisions. Some, especially in Pacific Island countries where the digital infrastructure is not as robust, have turned to home or community outreach services, and so on and so forth. So I think when we examine the story of mental health during the pandemic, there are two main threads that really come out. One, it's been very difficult for all. So I think we can all relate to experiencing some form of anxiety or distress, especially during times of the surge, and especially in the beginning where so many things were unknown or uncertain for us. And the second thread or narrative we see about the impact of COVID-19 on mental health is really this disruption in services and the vulnerabilities of certain groups, our healthcare workers, young people, older adults, among others, who have really felt the brunt of this pandemic. So where do we move on from here? And now going to the theme of today's topic, which is building back better. How do we build back better under the present scenario? And we start by really having a clear picture of what is it exactly that we're building towards? What is the future of mental health? And this is a question that we've been discussing over the past year and a half at the WHO as we proceed to develop a new regional framework for the future of mental health. Now, a few months ago in July, we convened the region's experts in mental health and posed this question to them so that we can start co-creating this vision together. And I'm sharing with you some of the highlights from that meeting because the process of consulting stakeholders, our member states, is already underway, and we would like to get your views, your feedback on this vision as well. But basically, the vision we see moving forward from the pandemic in building back better is a region where people enjoy the highest level of mental health and well-being, grounded by social solidarity, for a transformative environment that promotes mental health for all. How do we achieve this vision? One, we have to refocus to include mental well-being and reaching the unreached. So equity will need to be a big focus of the work moving forward as we build back better. And we say refocus because, as I mentioned earlier, if you go back to the original definition of health, really well-being is front and center in that definition. And we need to transform our mental health care. We've seen how global health emergencies can be extremely disruptive to service provision. But at the same time, we also recognize that a lot of this distress, a lot of this mental distress, are driven by social determinants, education and schooling, employment, financial stress, social isolation. So when we transform mental health care, we're not only referring to health services, but social services as well, working together in one mental health ecosystem to provide people the support that they really need to go move on from in their lives. And last but not least, critically, we have to embed mental health into the settings of daily life. And I think this is where the environmental and occupational health community as a whole can really play an important part in building back better for psychosocial wellness. We do have a guide rather, or a way forward, and I think it's good to be reminded that even before the pandemic we were already moving towards one global health agenda, which is informed by the UN Sustainable Development Goals. And in the UN SDGs, we see that mental health is really shaped by a broad range of factors across different domains. Addressing the broader environment will promote mental health. And in this slide, you can see several proximal and distal factors that impact on mental health that we've mapped out across practically all of the SDGs. So yes, while mental health is reflected particularly in SDG 3 on health, there are various other factors or determinants of mental health that are related to almost all of the different SDGs. And zooming in on two particular areas that are relevant to environmental and occupational health, it's our neighborhoods, whether they are safe, our housing, the infrastructure and built environment, whether we are moving towards steps to prevent violence, addressing climate change, even enforced migration. So here, I just go back to the principles of health promotion during the era of sustainable development. And one key principle here or pillar is healthy cities. And I want to zoom in a little bit on this as I wind up my intervention for this morning. And this framework was actually developed by the Center for Urban Design and Mental Health. And from their perspective, when we think about environments that promote psychosocial wellness, we have to mind the gaps. And what does that mean? One, we have to have green places. There is an abundance of evidence that shows that access to nature, being in and with nature is good for mental health and well-being. We need to have active places. Physical activity is also good for mental health. Pro-social places, our cities can sometimes feel very lonely and isolating, which is ironic because there are a lot of people in a very confined space. So urban design should facilitate these safe and natural interactions among people. And they have to be safe. Appropriate street lighting, distinct landmarks, law enforcement, all of this come into play in designing urban environments that actually promote psychosocial wellness. And in an era where a lot of people are frankly just feeling anxious, tired, and depressed, we need cities that are restorative, that are places where we can heal and take a break and actually feel reinvigorated. And the intersection between architecture, design, environment, and health is not new. In fact, when we think about our typical idea of what modernist architecture is, bright, airy spaces with a lot of ventilation, circulation, actually this movement in architecture was heavily influenced by health, because at the time when they were building structures, there was a recognition that we have to build structures, for example, that prevent the spread of respiratory diseases, tuberculosis. And now with COVID-19, we see a re-emergence of the appreciation of design, restaurants having open air, alfresco areas, etc. So can we design for health and well-being? I think we can, and we should be very purposive when we think about how exactly do these spaces look like that not only prevent or help protect us from respiratory diseases, but actually enhance our overall health and well-being. Because, our homes, for example, now, there are private spaces, but there are also productive spaces. This idea of working from home, I think, is already firmly entrenched, and we should anticipate that this will be part of the norm, part of this new normal or now normal moving forward, even as we renegotiate our work, our ways of working. So what kind of space will allow you to be productive but still give you that private space where you can enjoy yourself and relax and still feel at home? And for our workplaces, I think the future of workplaces and working is hybrid. and it has to be flexible. And our environments have to allow that flexibility and that hybrid work structure, especially as we, as I said, no, renegotiate again our ways of working after almost 2 years of working remotely for many of us. And for our public spaces, they have to be functional, but they also have to be social too. Cities confer many advantages because of the built environment and how services can be arranged within an urban setting. And I think there is a very big role, no, for the environmental and occupational health community here in determining what exactly are the features of these environments that promote psychosocial well-being. So I'm going to end it there, and I'd just like to say thank you again to the Department of Environmental and Occupational Health for organizing this very timely forum. I hope that this was helpful in providing some perspective on what exactly we mean when we talk about mental health, the significant impact of the COVID-19 pandemic on psychosocial well-being, and ways of moving forward, especially as we build back better and reimagine a healthier, a safer, and maybe also a kinder environment for all of us. So thank you again and good morning, and I look forward to the open forum.
Okay, so thank you so much, Dr. Ligot, for explaining how psychosocial wellness can be promoted. Okay, the next presentation is about herd immunity. And during the pandemic, we know that vaccination has been one of the public health in combating the COVID-19. Our next speaker will discuss how herd immunity will be achieved. Let us all welcome Dr. Rachel Nikahau.
Thank you, Professor.
Dr. Rachel um, Dr. Rachel Nikahau is the OIC Director 3 for Systems Integration, Disease Prevention and Control Bureau of the Department of Health. She has served the department in various capacities as Deputy of the COVID-19 Surveillance and Quick Action Unit, as Medical Specialist 2 of the Health Facilities and Infrastructure Development Team, Department of Health. She has also served PhilHealth as Medical Specialist 3 as part of the Primary Healthcare Benefits Team. Dr. Howe was the Atlantic Fellow for Global Health Equity, Milken Institute for Public Health, George Washington University. She also obtained her Master of Science in Health Policy Planning and Financing degree from the London School of Hygiene and Tropical Medicine and London School of Economics. Now, you may now proceed with your presentation. The virtual floor is yours.
Thank you, Professor Vic, and good morning to everyone who is joining us in today's forum. So for this morning, what I prepared is um, an overview of how we at the Department of Health are actually looking at how we can safely reopen all of our institutions. And as mentioned, nga, no, that vaccination is really one of the key tools that we're seeing to make sure that we can open safely all of our activities. But before I go to the specifics of the vaccination program, I wanted to inform everyone of the considerations that we at the DOH and specifically at the Disease Prevention and Control Bureau look at when we design all of our policies and all of our policy recommendations on decisions that are being made about shifting to this new normal. So basically, our decision points fall under if these four considerations have been met. No? And these four considerations include one, the transmission is being controlled. Second, that there's minimum public health standards and health system capacities in place. Third, that we minimize our outbreak risks for the vulnerable, and for those who are at most risk for high transmission. And of course, that these are done in consultation and engagement with all of the stakeholders. And while this seemed to be more all-encompassing principles, this is actually what we've been using in all of the sector-specific guidelines that we do. So this is actually the same principle used in safe reopening of workplaces, safe reopening of schools, safe reopening of restaurants, gyms, cinemas, no, anything that we want to implement our standards nga on the new normal. So I'll start with the first one po. No? In this concept of transmission being controlled, the national government has adopted the alert level strategy. And I'm sure this is something that everyone had to learn in the last couple of months. But this is shifting the way that we classify areas based on risk and making sure that we also balance that safety aspect, no, and the opening aspect by limiting restrictions only to high-risk activities. And we have classified these high-risk activities to include the 3Cs, or yung closed, crowded, and close contact settings. So because we want our strategy to be risk-based, yung mga parameters din natin for opening are dependent on risk, no? So wherein kapag mas mataas yung risk or our alert level 5s, we usually do not allow these high-risk activities to happen. And the lower that we go to our alert level systems is we can have more confidence in opening up these activities. And another thing that we link into this overall strategy is the protection that vaccination brings. No? So as you can see, there are two separate charts here that, especially in indoor settings, wherein it's actually one of our 3Cs, no, kasi closed. The safeguard that we put in there is that there can be opening or there can be increased capacity provided that individuals are fully vaccinated. And in safer settings, such as outdoor settings, there can actually be more mobility and more activity in those types of areas. The whole design also incentivizes what I'll talk to you later about, which is the safety seal concept, or wherein that's the assurance, no, that the institutions have been checked to see that they comply with all of the standards. And there's also an additional incentive that if the specific local government or the specific area has higher vaccination coverage, then they can actually have more increased capacity. So it basically what I wanted to show in this slide is this marrying of balancing that risk and benefit by incentivizing the safer activities and making sure that we have safeguards in the less safe or the 3C activities. In terms of the specific standards, I hope all of us are already familiar with this PDITR and vaccination strategy. But basically, these are all of our standards regarding the implementation of MPHS. So we have expanded the understanding of public health standards to not just mean wearing a mask and washing your hands, no, but all of the institutional and the systemic things that have to be in place, especially in terms of engineering, administrative controls, to make sure that we are opening po, no, with all of these safeguards in place. And as I mentioned, these are the same principles that we've been using across all of our strategies, across all of our settings. And what we have been promoting and what we also have been communicating is that we all know we have to open, no, all of these activities because these address our social determinants of health, no, economic activity, education, nutrition, our environments, our communities. They are very important to a person's overall health and overall well-being. And the way that we will be able to do all of this safely is if we implement safeguards of vaccination, our safety seals, and the promotion of outdoor built environments. And moving forward, this is what you will be seeing more from our national government, incentivizing these three safeguards in different shapes and forms, so that we are all more confident, no, in living with this virus as we dance with the pandemic. So this, again, the safety seal certification, for those who are not familiar, is the scheme wherein we affirm that the establishment is compliant with the minimum public health standards. And there's also ongoing discussions right now about including some of the principles of COVID-19 mitigation, especially in specific workplaces, to be part of routine health and safety assessment, no, across all of the settings. So that's also something to anticipate in the near future, and it's something that all of the different agencies listed here, DOH, DOLE, DTI, DILG, and all of the others po, no, are trying to figure out how to make sure na itong ginagawa natin for COVID not only will be implemented for COVID, but will also be implemented for long-term health and safety. And all of this, we actually put into our information materials, especially itong aming handbook that we constantly update based on the most recent evidence that tries to summarize all of these health protocols. So I wanted to put that part first because I wanted all of you to understand that when we talk about safe reopening, it's not just one magic bullet, no? Hindi bakuna lang. But as I move forward to the rest of the presentation, I will talk about the importance of vaccination. But that first part hopefully gives out the message, no, na this is one of many simultaneous strategies that have to be put in place to make sure nga that we can sustainably and safely live with this pandemic. So, if you remember yung 4 principles I mentioned earlier, one of them is the principle of minimizing outbreak risks for the vulnerable. And the way that we minimize these risks is to, of course, make sure that we have our health system capacity, hindi siya overwhelmed kasi ibig sabihin if anyone gets sick, then they can actually be treated at the hospital. So we don't want our hospitals being overwhelmed. But aside from that, our main strategy for minimizing risk, especially for the vulnerable, is our vaccination strategy. And if you recall how the national government created the prioritization framework, it really prioritizes those who are at most risk for severe disease and death. And that includes A1, our healthcare workers, A2, our senior citizens, A3, yung ating mga adults with comorbidities, and all of the other exposed individuals moving forward. No? So all of the decisions, especially about the vaccination program, really look at what's the best way to protect and to incentivize these highly vulnerable groups to have this additional protection through vaccination. So we also know that at this point, no, ang mga pwedeng bakunahan are the 12 years old and above. And that leaves a percentage of the population that cannot be vaccinated. And the way to protect them in relation to herd immunity is the concept of cocoon strategy, no? Or basically what that means in layman's term is if persons who cannot be protected with the vaccine are surrounded by people who are protected by the vaccine, then the risk of being of having disease, no, or being transmitted the disease is less kasi nalalagyan sila ng parang protective bubble. And I have a visualization later to explain that further. No? But especially, this is our strategy for the population groups who, again, cannot be vaccinated either because they're not yet eligible kasi mga bata pa sila at wala pang vaccines that are authorized for their use, or for those adults na there's really conditions within them that do not let them have the vaccine at this point. No? So this concept of cocoon strategy is actually also similar to, and I'll go na lang ito, is also what the herd immunity concept actually explains. No? Ang ibig sabihin kasi nitong herd immunity is that protection you get because of the people around you being protected. So, for example, and I'll do this as an illustration, if only a few people are vaccinated, or the blue people in the left side, in the left side of the screen. No? So kapag one person is affected, itong ating orange person, there are many opportunities for the virus to travel, no? Kasi maraming mga gray or unprotected people that they can actually infect, no, and further transmit the virus to. But if many of the people are vaccinated, mas madami yung blue, as in the right side of the screen. If there will be persons who will be infected, there are less opportunities for the virus to spread far. No? And that's basically the concept of herd immunity. The decision to be vaccinated not only affects you, but actually also protects the people around you and your whole community. No? And that's why it's actually being, vaccination specifically is regarded as a population health strategy. It's regarded as a public good because this decision affects not just you, but also the other people around you. And this is why I also want to go into how everyone should actually be part of this strategy, this type of work, especially in increasing the confidence for vaccination and the confidence in our vaccines, and increasing our vaccination rates to meet our targets. Because as I mentioned, this is a decision that affects everyone. No? Usually when we do these information sessions, especially for vaccination, our key messages are summarized as follows. So the first is that all of our vaccines are safe, they're effective, and they're free. No, they're provided for by the national government. And although there may be some risks, overwhelmingly through global evidence, it says that the benefits significantly outweigh the risk, no? And it provides us this protection against the severe infection. So anyone who is eligible should really use this opportunity to get vaccinated through their LGUs, and then after vaccination, of course, to still practice all of our minimum public health standards, regardless of vaccination status. This concept of herd immunity is a well-known fact for all immunization programs. But what I wanted to highlight in this next set of slides is that specifically for COVID-19, and as mentioned by the World Health Organization, so these snippets actually come from the World Health Organization. While herd immunity is really the target or is really the goal for any vaccination program, at this point, no, especially with the still evolving nature of all of the evidence for COVID-19, wala pang agreed upon threshold of what percentage of the population is needed to be vaccinated in order to protect the rest. No? So that usually takes years kasi to create and to study. And there are different levels depending on the different diseases. So actually, iba ang threshold, for example, ng herd immunity for polio, for measles, and all those kinds of things. And what globally is recognized at this point is that we still don't know what that threshold is. And that's why the push, no, from the WHO and from all of the different countries is really to vaccinate everyone. And that's really been how we have also identified the operational targets for the vaccination program in the country. So for this year, the target, and it is something that looks like we're going to meet by December, especially with the upcoming National Vaccination Day, is to vaccinate at least 70% of all of the eligible populations. And as I mentioned, our eligible population right now are everyone that's 12 years old and above for their primary series, and for boosters, for the healthcare workers, for the seniors, and the immunocompromised adults with comorbidities. For next year, we will complete everyone's primary series for 100% of the eligible population. And then, of course, all of the groups that will be eligible and will be authorized to have additional doses or boosters. So I'll end this talk with really going back to the meat of it. No, we were all put into this pandemic. No one wanted it. No, and it really caused a lot of disruption in everyone's lives. Um, and we all have to understand that what we want to um, stop affecting our lives is COVID. No, the only enemy is COVID, and actually, vaccine is one of our allies to help us go through and live with COVID being part of our lives for the longer term. The campaign of Res Vacuna is really a way to communicate na the vaccines is actually reinforcement, no? Parang rest back or we have your back, kasama siya sa laban natin. And in comparison to the previous year, this year we have an additional tool, this vaccine, no? And this is a tool that we should be using as much as possible, as much as we can. Ngayon that we have this karagdagang protection, no, we should be doing our share of the work then of encouraging everyone who should be vaccinated to be vaccinated, because as I mentioned, this is a decision that affects not just you, not just themselves, but all of the people in your community and even the country. And just so some reminders before I end, really looking at longer term or medium term for our country of uh, more comfortably going back to our previous activities. We really want to ramp up coverage of vaccination everywhere in the country. The Happy Christmas appeal, no, has been communicated since early of this quarter na really we want to get all of, especially magde-December na, no, na um, that we can do some of the activities that we've used to be doing once we have a certain percentage of the population protected. And really this event on November 29 to December 31 is a massive national drive to make sure that anyone who has not yet been vaccinated be given that opportunity to access this product, no, and to also have LGUs make sure that this be accessible, especially at this time. So I'll end with the slide I skipped earlier about key messages. No, so when we talk about safe reopening, as I mentioned earlier, it's not just one magic bullet. It's all of these things working together to make sure that everyone is safe. And there are different and cumulative layers of protection that we can give to everyone. At the level of the person that's being vaccinated, making sure you still implement your MPHS with all of our behaviors, no? So wala pa rin muna tayong mga beso-beso and all of those kinds of things. And of course, wearing the appropriate PPE, such as the wearing of masks. But aside from being those safeguards as the person, within our families, we also have to encourage vaccination. We still have to do our public health standards and our frequent disinfection. And of course, yung masking, distancing, and sanitation. And in whatever establishment you are part of, whether that be a school, a workplace, or even commercial businesses, no? We make sure you comply with all of our strategies through the safety seal. Ensure that people in your establishments still do the minimum public health standards, and that you have mechanisms in place to coordinate with the LGUs and the hospital systems. And as a community, really this prioritizing vaccination and encouraging vaccination of everyone and implementing continuously our protocols will continue to protect all of us as we open the economy. So thank you, and I hope that this presentation gave you an overview of the topic at hand. Salamat po.
Okay, so thank you so much to our resource persons, Dr. Ligot and Dr. Howe, for your presentations. Actually, we are receiving a lot of words of thanks and appreciation from our participants. Okay, so at this point, let us now proceed with answering the questions from our participants. Okay, so let me start with Dr. Ligot. The first one is for your comment and recommendation. The question is, I suggest to decongest Metro Manila, being the center of finance and government activities, using nearby provinces like Quezon, Lucena, or Pangasinan can improve mental health or those living in Metro Manila. For your comments, Dr. Ligot, please.
Thank you, Doc Vic, and thank you for that comment. Yes, certainly we have to consider strategies of decongesting. And we've actually been looking at crowding or overcrowding as another determinant of mental health. And I agree, no, we have to be looking at ways of moving people or decentralizing our urban spaces. But of course, that's not easy. I mean, when we do invest in other urban spaces, we have to look at transportation, for example, whether or not those places where we intend people to move to have enough work opportunities, schools. So basically, conceptually, yes, we have to look at other urban centers and really start decongesting as much as possible. But we have to make those spaces attractive to live with, to live in the first place, so that people are inspired to move there and uh, and build their home there. And I think one important stakeholder that we maybe should be working more closely with, and that we don't dialogue as much, is actually the real estate sector. A lot of major township developments, villages, etc., are sprouting up outside of Metro Manila. How much of these master plan developments have a public health perspective in mind? I don't know. So it might be good for us to start dialoguing with our colleagues in architecture, urban planning, etc., so that when they create designs, they also have health and well-being in mind.
Thank you so much for that response, Dr. Ligot. The next question here is also addressed to Dr. Ligot. In your presentation, you mentioned about systems approach to address mental health. Do you recommend that mental health considerations be incorporated in the design of infrastructure and development projects?
Absolutely. Um, a lot of when we talk about the work that we do in mental health, a lot of it focus on social relational issues. So we help patients, for example, or people going through mental distress to better understand their thoughts, their feelings, their emotions, and we give them therapy, or sometimes we prescribe medication to control their symptoms and make them feel better. But then after we, in a way, we build them up in the clinic or in the mental health center, and we release them to an environment that is violent, that is unsafe, that is difficult to navigate. I think it's not, yeah, they get broken again. So we have to extend the work that we do in mental health to impact on the social structural spaces. And that's really where a lot of opportunity lies in environmental and occupational health, in how we design our homes, how we design our workplaces. And then from the perspective of occupational health, how do we design work? Right now, a lot of people um, don't have work, are not employed, and that is a major stressor in their lives and contributing to their mental distress. But when they reintegrate into the workplace, the workplace has also changed so much. So I think there's a lot, again, no, there is a very important role here in terms of advocacy and really working with other sectors in designing spaces and designing systems that are purposive and that promote health and well-being.
Okay, thank you so much, Dr. Ligot. The next question is addressed to Dr. Howe. Um, would you agree to use incineration technology just like other developed countries like Japan for the control of outbreak? Do you need to amend RA 9003 to include incineration plants in all sanitary landfills in our country?
Thank you for this. No, I think the answer for that is specific to COVID at this point is there are no strong recommendations to do that. No? So these were debates that were actually happening at the start, especially at the start of the pandemic, kung ano yung gagawin sa mga remains of COVID. And if you could see, before it was actually stricter, kailangan cremation and all of those kinds of things. But later on, with more guidance coming from global studies, even from the WHO, ngayon actually it's considered na parang regular infectious waste, diba? Double bagging, and those kinds of things. So of course, this is evolving evidence, and of provided that there will be signs in the future that this is necessary, we're very early and easy naman to adopt. No? But siguro the quick answer at this point is it's not yet being recommended. But as long as there will be recommendations for that, then that's something that we will, of course, have to adopt. Thank you.
Thank you very much, Dr. Hao. The next question is about safety seal. Does the safety seal also applicable to small-scale businesses?
Yeah. So itong safety seal program, just for those who are not familiar, it's led by the Department of Trade and Industry. So there are a set of protocols, especially nung first wave of this, that is geared really towards businesses. No? And it's actually meant to be for all types of businesses. Kasi for example, even the ventilation standards doesn't have to mean naman that you always buy expensive capital outlay equipment. No? So that it actually is space specific. So that can include opening windows, etc. So it's actually meant to be all encompassing. But I think because the certification process is done through local governments, and I guess hindi rin pa ganon ka well-known yung processes, majority of the establishments that have applied for a safety seal are the larger establishments. No? So kaya nga yung sabi ko kanina, yung ongoing conversations namin right now are to actually include some of these concepts in the routine health and safety screen that happens every year. Kasi basically, it's the same concepts din naman, di ba? Ventilation, space requirements, no? So that's something that's going to happen. But quick answer is it's actually encouraged that even small businesses use it, and the guidelines have been made flexible enough that small establishments should actually be able to use it. But later on, we can expect that some of these principles will slowly be part of our routine health and safety protocols. Thank you.
Thank you so much. The next question here is for comment or probably a little bit of elaboration from Dr. Hao. It's about the rationale of unvaccinated people having restrictions during certain alert levels compared to vaccinated. So, as mentioned here, vaccines do not promise decreased transmission of virus. So, what is the advantage of vaccinated in terms of utilizing indoor services over the unvaccinated? For your comments, Dr. Hao, please.
Okay. So thank you, Ren, for this. No, really, the concept of cumulative layers of protection has been one of the rationales for this. So the decision kasi to open is not a light decision, no? That's actually very heavily debated, especially of our decision makers. Nagbabattle yung health, yung econ, and all of those types of concepts. And one of the meeting points were that we identify ano yung activities na talagang at high risk, no? Na parang kailangan may safeguards before we open. And once those activities were identified, yun nga yung naging 3Cs, closed, crowded, etc. To make sure na we are able to open that safely, nag-isip din ano yung parang mga non-negotiable safeguards. So tama naman kayo, no? The vaccine is not 100% foolproof. Of course, there will still be people who are vaccinated who can still have the disease and who can still transmit. But overwhelmingly and significantly, especially percentage-wise, it's protective. So it's thought as one additional layer of protection, especially in these higher risk activities. Pero sabi ko nga, it's not that alone. Kailangan din may safety seal, kailangan din, minsan may mga additional measures pa. No? So for example, pwedeng mag-sine pero bawal kumain. No? So may mga specific things na nilalagay. And that's the balancing and negotiation act on all of it. And yung other argument din kasi for doing that is the goal of population coverage for vaccination and the shift towards having incentives and disincentives. So that's another rationale, no, na parang that's a way to incentivize people who are on the fence about vaccinating to be vaccinated. But yes, definitely we do not claim that vaccines are 100% transmission blocking. And alam naman natin na ongoing pa yung evidence nun. But it's really thought of as an additional layer of protection. Thank you.
Thank you so much, Dr. Howe. The next one is also for your comment with regard to face shield. Do you honestly think that we need to wear a face shield aside from face mask, even if the WHO don't recommend it?
Okay, sige. So actually, buti magkasabay yung tinanong kasi link naman yung sagot ko. That di ba? Face shields are always thought of as additional layers of protection in high-risk settings or high-risk areas. So actually, this is one of the most controversial and even highly debated things. Kasi actually, I want to disabuse the notion na WHO does not recommend it. Actually, recommended nga siya sa lahat ng healthcare workers. Diba? So it works. It protects. Kaya nga siya required in all infectious disease at a hospital setting. And that's been the push, especially of our health experts, kung bakit hindi recommend nila na gamitin din ng public. The main parang argument this is parang if it's good enough for our healthcare workers, why is it not good enough for the general population who needs additional protection? So especially during the time na hindi pa ganun kadami yung bakunado, at saka during the time na mataas yung mga kaso natin, these were really thought of as additional layers of protection. But now that we're moving to lower community risk, nagkaroon din ng more confidence to slowly strip away these required or these mandatory layers of protection. So actually yun din pala, no? The contentious part there kasi is the mandatory side of it. No? In other countries, it's being recommended but it's not being made mandatory. And I think yun yung parang mas naging political issue about all of it. But yes, especially now we're in alert level 2, we're in lower risk settings. We can be more liberal with those additional layers. But the guidelines have also been made na should there come a time na mag-spike ulit, mag-surge ulit, pwedeng ibalik, no? Na that's what we actually do. And what we can actually look forward to, is, especially kung mag-continue ito, is all of the other layers then we can remove, no? So kapag tumaas yung ating vaccination coverage, mawala talaga yung mga kaso, eventually even our masks will have to So these are really parang unti-unti tayong nagtatanggal ng ating mga layers of protection provided na we have that level of confidence already. Thank you.
Okay, maraming salamat po, Dr. Howe. In the interest of time, we can only have the last question, and would like to give the last question to Dr. Ligot. The question is, are there existing programs at the national or local level for mental health directed for the frontliners and the health workers? Dr. Ligot, please.
Thank you. I may have to actually defer to my colleague Dr. Howe for that. She's probably more familiar with the programs that are being used offered by government. But I do know, for example, that there are some specific initiatives that are being carried out by various healthcare organizations, large hospital groups, for example, providing direct support to their frontline workers. The Philippine Mental Health Association, of which I'm a member, has launched specific initiatives for our frontline workers, providing online counseling, online therapy, online support sessions. And well, earlier in the pandemic, now we also saw an outpouring of support, community support for our healthcare workers, which I think is good for morale and it's good for them to, what you call this, to know that they're being supported. But I feel, and this is speaking as a doctor myself and with a lot of colleagues and classmates who are in the front lines, the best way we can actually support their psychosocial wellness is to follow these minimum public health standards. Because sometimes, there is a tendency, diba, na we take for granted the sacrifices sometimes of our healthcare workers. And the best way to show support, to make them feel that they are, that, as a community, we're supporting them, is to follow these standards and to take care of ourselves so that we don't end up in the emergency room and adding to their workload. Our healthcare workers are committed, they are excellent, they're very competent, they know what they're doing. So the least we can do for them, for their own mental health and well-being, is really to take care of ourselves as a way of showing support for them. So I'll leave it there, and then maybe Dr. Howe has anything to add about specific programs so that the government might have for the mental health of our frontline workers.
Yeah. Um, siguro, well, tama naman si Dr. Jason. The there are many reasons kasi that people have mental health issues. For those who are experiencing it right now, some of the more immediate things that have been done by the DOH in the past pandemic is yung pag-provide ng mga hotlines, giving out information, encouraging the leaderships of the hospitals and even the workplaces to institute policies. So that's on the parang urgent need to address at this point na response. No? But what I want to highlight is we all know that mental health issues are not purely an individual problem, no. It's happening because of problems in the society, problems in systems, problems in structures. And kaya nga what I was focusing on in this lecture is itong very explicit plan to safely reopen is actually one tangible strategy to make sure that we address mental health problems. Kasi I mean, it's not purely a mental health problem. If the problem is wala siyang job, wala siyang makausap na kaibigan kasi nasa bahay lang siya, no? So we are doing it both ways, doing the urgent support right now, and then of course trying to make sure that the mechanisms that are facilitating these issues are addressed as quickly as possible. And the DOH to the Health Promotion Bureau is also actively creating right now this healthy settings framework. Kunyari, healthy schools, healthy workplaces, healthy communities, wherein yun na yung parang buong health package, and mental health is a clear component of that health package. So because everyone was busy with the pandemic, a lot of the priorities shifted. But now that we have time to move towards these next year, we hope to that the public will be able to see all of these new developments, especially for mental health, that will come up. Thank you.
If I could just quickly add, I think also sometimes we have a perception that when we think about mental health problems, we're only referring to the clinically depressed, and that the burden of providing support falls on mental health professionals, psychiatrists, psychologists, occupational therapists. But actually, there are many ways that all of us, regardless of your background and training, can promote and protect your mental health. And the number one strategy for that is to take care of your health. Make sure that you're healthy. Eat right, move more, don't drink, don't smoke tobacco. All of these are factors that can help promote and protect your mental health. And just checking in. Kung may kakilala ka, kaibigan, kamag-anak, kapatid, magulang na healthcare worker, tanungin mo sila, how was your day? How are you doing? Is there anything I can do to help you with what, to lighten your load? And kung wala naman, just spend time with them. Watch a K-drama, whatever it is that will help them maybe relieve some of the stress. Those are ways that all of us can do to promote and protect the mental health of our frontline workers.
Okay, so maraming salamat po. Thank you everyone for the fruitful discussion. I would like to thank our speakers, Dr. Jason Ligot and Dr. Rachel Nikahau, by awarding these certificates of appreciation. The certificates reads College of Public Health, University of the Philippines, Manila, Simeo Tropmed Regional Center for Public Health, Hospital Administration, Environmental and Occupational Health awards this certificate of appreciation to our speaker for invaluable contribution by sharing expertise as resource person during the 4th National Environmental and Occupational Health Forum, conducted by the Department of Environmental and Occupational Health, done remotely from the College of Public Health, University of the Philippines, Manila, on 25 to 26 November 2021. Given this 26th day of November in the year 2021 in the city of Manila, Philippines. Signed, Dr. Paul Michael R. Hernandez, Chair and Overall Coordinator, Fernando B. Garcia Jr., Assistant to the Dean for Planning and Development, and Vicente Y. Belisario, Dean and Center Director. Okay, so the College of Public Health, University of the Philippines, Manila's Simeo Tropmed Regional Center awards the Certificate of Appreciation to Dr. Jason D. Ligot. Thank you, sir. And the College of Public Health, University of the Philippines, Manila, Simeo Tropmed Regional Center awards the Certificate of Appreciation to Dr. Rachel Nikahau. Okay, thank you so much. No? And at this point, we would like to thank in a very special way our excellent speakers. And this concludes our second panel discussion, advocating for psychosocial wellness and COVID-19 vaccination in workplaces and communities. We will now have our wellness break, and our program resumes at 10:30 a.m. This has been your moderator, Dr. Vic Molina. Thank you so much for the opportunity to join you in the panel discussion. See you later.
good morning again. I hope you're ready to listen again in 2 minutes. So please be back by 10:40. Please return to your devices so we can resume the next session on time. Thank you. See you in 2 minutes. Hi again, everyone, and welcome back to our session for this morning. I hope you were able to take a break from sitting. And as we proceed with the panel discussion, we raise the question, how far are we in attaining the Sustainable Development Goals with the current challenges in our EOH systems amid the COVID-19 pandemic? We will be hearing shortly from the Philippine National Economic Development Authority. But before we proceed, please allow me to introduce our next moderator. Okay, Mr. Harvey C. Domingo is a registered physical therapist. He obtained his Bachelor of Science in Physical Therapy from the College of Allied Medical Professions of the UP Manila in 2014. He is currently working on his thesis for the Master of Science in Public Health major in Biostatistics program at the UP College of Public Health. Prior to teaching to UPCPH, he has worked as a part-time instructor at the Department of Rehabilitation Sciences of Arellano University from 2014 to 2016, and as an assistant professor at the College of Physical Therapy of New Era University, and also as an instructor at the School of Physical Therapy, Occupational Therapy, and Respiratory Therapy of Emilio Aguinaldo College from 2016 to 2017. He also served as project assistant to the research project Chronotype Specific Adjustment to Shift Work of Contact Center Agents in the Philippines, Chronotype of Filipino Non-Shift Workers and Shift Workers under the UP Center for Integrative and Development Studies in 2016. I would now like to turn over the virtual floor to our moderator, Mr. Harvey Domingo. Sir Harvey.
Thank you very much, Professor Abby Duarte. Welcome to our concluding lecture titled Achieving Sustainable Development Goals in the Post-COVID Era. In yesterday's welcome remarks, our CPH Dean, Dr. Belisario, reminded us that the end date of the SDGs is closing in, and he emphasized that we need to continue to align our efforts to achieve them amidst the disruptions in health services delivery. In this concluding lecture, we hope to know more about moving forward to a post-COVID era and continuing our work to meet our sustainable development goals. For this session, we would like to remind our speaker that only 20 minutes is allotted for your presentation. Messages will be sent to you via Zoom chat box to remind you of your time remaining. Our lone speaker for the session is Ms. Girly Grace J. Casimiro Igtiben. Ms. Casimiro Igtiben is the OIC Director of the National Economic Development Authority Social Development Staff. She's an economic development specialist with experience and rigorous training in leading and managing people, policy formulation and analysis, development planning and program and project development, and evaluation and monitoring. Ms. Casimiro Igtiben has significant experience in the field of social inclusion, social protection, poverty, sustainable development goals, labor, welfare, housing, maternal health, health financing, and gender. Ms. Casimiro Igtiben earned her Master of Arts degree in Development Studies from the International Institute of Social Studies, Erasmus University, the Netherlands, and her Bachelor of Arts degree in Development Studies from the University of the Philippines, Manila. Let us all listen as Ms. Casimiro Igtiben discusses how SDGs will be achieved during the post-COVID era with the Philippines as a case study. The virtual floor is yours, Ms. Casimiro Igtiben.
Thank you so much, Sir Harvey, and good morning to everyone who's in this forum this morning. And let me walk you through the Achieving Sustainable Development Goals in the post-COVID-19 era. Next slide, please. So I will be presenting the overview of a quick overview of 2030 Agenda and the SDGs, and then the pandemic and its impact to the SDGs, the strategies and post-recovery, and a bit of synthesis. Next slide, please. So just to refresh our memory, because this past 2 years, it has all been pandemic, COVID, and some people have already forgotten about the Sustainable Development Goals, which we must be achieving by 2030. We have 17 goals, we have 169 targets, and we have 232 unique indicators that are integrated, indivisible, global in nature, and universally applicable. In our country, in the Philippines, we are currently monitoring an initial set of SDG indicators, which consist of 155 indicators all throughout these 17 goals. And then out of these 155 indicators, 102 are actually global indicators, 28 are the proxy indicators of the Philippines, and 25 are supplemental indicators. Next slide, please. Our SDGs actually embedded in the Philippine Development Plan, which is now the 2017 to 2022. It is first of the 4 Philippine Development Plans for us to be able to achieve the SDGs and the Ambition Natin 2040. So next year, we will be moving forward to the 2023 to 2028, the new Philippine Development Plan of the next administration. Ambition Natin 2040 is actually envisions the Philippines that by 2040, everyone will be a prosperous middle-class society where no one is poor, meaning Filipinos want to have a matatag, maginhawa at panatag na buhay para sa lahat by 2040. And that is after achieving the SDGs in 2030. Next slide, please. So the SDGs are actually integrated into our Philippine Development Plan, and it is further translated at the local level in the regional development plans that we have. And some local government units already adopted the SDGs prior to the pandemic to their local development plans. So some of the indicators are already translated in the regional, provincial, and even municipal and city for those who have adopted the Sustainable Development Goals. So if people are usually asking, where can we find the strategies in attaining the Sustainable Development Goals? It can be found in the updated Philippine Development Plan, in the regional development plans, in the local development plans, and of course, some sectoral plans also included the SDGs, like the health plan, the nutrition plan. It all included the SDGs in the sectoral plan. So we can say that the SDGs were already mainstream in the different plans of the national and the local government. Next slide, please. So this is to quickly show you, this is the current framework of the updated Philippine Development Plan, which is still anchored on the 2030 agenda. And we updated this early this year to change our goal to a healthy and resilient Philippines, because seeing what happened in the pandemic, the effects of the COVID-19, and the strategies that we have been doing for us to be able to cope with the COVID-19 pandemic, like the lockdowns, the minimum public health standards, the vaccination. So we need to set our goal. We need to change our goal into being a healthy and resilient Philippines. So we still have those three major pillars, your malasakit, pagbabago, and patuloy na pag-unlad. And down the line, you will see that the different sectors are under that. The human development sector is under the pagbabago or transforming towards equity and resiliency. Transform human capital development towards greater agility and ensuring food resiliency and reduce vulnerabilities of Filipinos. That is where COVID-19 pandemic strategies are coming in. Of course, with the support of the other strategies coming from the other sectors. And then we have your down when you see that pink bar down there, that is the cross-cutting strategies that will contribute to the different strategies that you will find under the malasakit, pagbabago, patuloy na pag-unlad na pillar. Next slide, please. On this slide, you will see how the Sustainable Development Goals have been integrated in the updated Philippine Development Plan. So you will see there your goals 3, which is good health and well-being, which is I will discuss further in this presentation. And it's under the Transform Human Capital Development towards greater agility. And all the other Sustainable Development Goals are scattered in the different sectors in the updated Philippine Development Plan framework. Next slide, please. So we have just to show you that how the Philippines is monitoring the Sustainable Development Goals. Last December 11, 2019, the subcommittee on the Sustainable Development Goals under the NEDA Development Budget Coordination Committee was created. It actually provides advice on policy integration and resource allocations for the Sustainable Development Goals. And it is the committee that is tasked to create the voluntary national reviews. Ano po yung voluntary national review? That is the assessment that we do every 3 years. Actually, that's every year sa UN. Pero the Philippines decided to submit its voluntary national review every 3 years. So we are reporting the status of our SDGs. And then we are also monitoring, as I mentioned, the SDGs are embedded in the Philippine Development Plan. So we are monitoring our programs for the SDGs through our results matrices and our socio-economic report. This year, the NEDA will be releasing in partnership with the different government agencies, will be releasing the socio-economic report. It is actually a report of what had we achieved on the Philippine Development Plan. And of course, it is also important to emphasize that the SDGs, for us to be able to achieve it, to monitor it, to implement the strategies, it's important to have stakeholder engagement. So under the subcommittee on the Sustainable Development Goals, there's a portion on stakeholder pledges and stakeholder engagements through a separate committee wherein the government and the non-government, including the academe, are interacting. Next slide, please. So in this part of the presentation, let me now go directly to discussing how the pandemic has affected the Sustainable Development Goals, most especially goal number 3, or good health and well-being. Next slide, please. This model illustrates how the different goals are actually linked with one another. Kasi yung ating pong SDG goals, they are not in silos or they are not standalone. As you can see in this slide, almost all the other indicators of the SDGs have a significant impact on SDG 3, which is, as I said, the good health and well-being goal. So aside from the COVID-19 sickness, uncertainties and policies that directly affect the sector may indirectly affect another. So that is what you will see in this model. For instance, yung unemployment po natin and poverty, it causes people to go hungry or eventually get sick. So this is similar to the imposition, it's also similar to, for instance, the imposition of mobility restrictions. Due to pandemic, it will make difficult to access appropriate care or commodities, which results to exacerbating sickness. So ganun po yung mga how the other goals are, other policies and goals are affecting our goal 3. Next slide, please. So the current goal of the current global pandemic has threatened and continuously put at risk lives and livelihoods globally, as highlighted in the 2021 Sustainable Development Report. Nag-release na po ang UN ng Sustainable Development Report. Next po. According to the report, the Philippines scored 64.5 out of 100 in terms of total progress towards achieving all the 17 goals. Next po. With this score, the Philippines ranked 103 out of the 165 UN member agencies. This is actually a lag because previously we ranked 99 out of 166 member states. So in 2021, we went down to 103. Next slide, please. So looking into each goals, the findings from that report show that the Philippines achieved only goal 13 or climate action. Yun po yung makikita nyong na goal. And meanwhile, other 6 indicators, including goal 3, good health and well-being, are moderately improving. So nag-i-improve naman, kasama yung goal 3 dun sa moderately improving. Others actually decreased. Next slide, please. Zeroing on the SDG 3, I will briefly run through the progress that we have made and some status of the country's health-related indicators. So you will see on this slide that in terms of maternal mortality and tuberculosis incidence, we are actually having major challenges because our indicator shows us that it even increased. And then the yellow lines, you will see that still some challenges under our accomplishments on under neonatal mortality had increased, and that death rate due to road traffic injuries, it slightly increased. Yung medyo nag-improve po sa atin is the under 5 mortality rate and infant mortality rate. Next slide, please. And then, of course, our births attended by our skilled personnel, it has increased. And then the percentage of population covered by social health insurance, it's 100%. This is because of the universal healthcare law that was passed, because it says that everyone is covered already by PhilHealth. When you needed it, even if you are not paying, then people can also access these services. Next slide. So this slide will show you the impact of COVID-19 in terms of mortality. Based on the mortality death data from the Philippine Statistics Authority, a total of 26.75 thousand deaths, or 8.8% of the total registered deaths from January to June this year, is due to COVID-19. So by classification, COVID-19 with virus identified and COVID-19 virus not identified were both included in the 10 leading causes of death. So COVID-19 with virus identified was the 5th, panglima po siyang cause of death in the country, with 17.16 thousand cases, or 5.7% of the total deaths that we had early this year. And then meanwhile, yung registered deaths due to COVID-19 with virus not identified accounted to 9.59 thousand, or 3.2% of the total deaths from January to June 2021, making it the 9th leading cause of death. Next slide po. As we now live in a pandemic and focus our efforts in COVID-19 response and recovery, we are facing some challenges and issues. Number one, the pandemic may slow down our progress or reverse our gains in achieving our sustainable development goals, because pre-pandemic medyo maganda yung tracking ng Philippines in terms of achieving the SDGs. It has actually, the pandemic has exposed and exacerbated the underlying and prevailing issues in our society, highlighted din dun sa ating tinatawag na Sustainable Development Report. Number one, we have inefficient social safety nets. So we saw this during the 2020, when we need to pass a law pa just for us to implement social protection related to the pandemic, yung ating pong mga SAP and everything. And then it exposed our fragile public health system, It showed the rising structural inequalities and yung ating alarming environmental degradation and climate change crisis. Yung biodiversity crisis and the pollution crisis persist despite the pandemic. So hindi naman po nawala yon. Concentrations of major greenhouse gases continue to increase despite the temporary reduction in emissions in 2020 when we implemented the lockdowns and other COVID-19 response measures. The world remains actually woefully off track in meeting the Paris Agreement. Biodiversity is declining and terrestrial ecosystems are being degraded at alarming rates. Also, with the COVID-19 present and expected to be endemic, we must really learn. Everyone must learn to live with the virus. Sabi nga po kanina ni Doktora, how we need to be vaccinated, we need to implement the minimum public health standards so that pag may possibilities pa ulit na surges may occur and vaccinate, we need this vaccination and minimum public health stand, social distancing, so that iiwasan natin yung mga adverse effects pa ng virus na yun, and we just live with it. Okay, and then third, it is also important to highlight the interdependence between the SDGs. Okay, next slide, please. So to address these issues, there have been some strategies on achieving SDGs in the post-COVID-19 era. Next slide po. Number one is synergy. So we need to integrate the SDGs and maximize the synergies between these goals. So SDG integration, the COVID-19 pandemic compelled the country to recalibrate the development plans. That is the reason why we changed the main goal of the Philippine Development Plan to having healthy and resilient Philippines to facilitate economic recovery. And then the SDG interdependencies, yung ating pong multidimensional impact of COVID-19 has shown us the interdependence of the sustainable development goals with each other. So it is really important to understand these linkages to foster coherent and synergized policies. Okay, next po is priority. So this is setting priorities for achieving short-term and long-term goal. We, at the start of the pandemic last year, the NEDA developed the We Recover as One report. Ito po yung sa tawag nga nila na binanggit kanina na new normal, and the recharge PH, which was also developed by the NEDA, and then we have the updated 2017 to 2022, which will guide us in implementing policies and programs that can contribute to the SDGs and at the same time prevent yung adverse impact of the COVID-19 pandemic in different sectors. Next slide po. And then under Chapter 10 of the updated Philippine Development Plan, we have this strategy. So guarantee care at all life stages. We need to ensure responsive and resilient health system. We need to have sustainable, equitable health financing. And of course, there are some cross-cutting strategies. Next slide po. Let me go through quickly each of these strategies. So number one, it is still important, especially with the advent of this COVID-19 pandemic, to have quality nutrition and healthcare interventions at all life stages. Kaya po kailangan nag-a-adjust din yung pag-respond natin, like yung mga school feeding natin, wala namang school, sarado. Pero the implementing agencies like the DepEd, the DSWD, and the NNC have adjusted their guidelines for them to be able to still provide feeding to those kids na who will need it, diba? Kahit nasarado po yung school. So those are the things that we need to do. We need to have uninterrupted provision of family planning services. Kasi nga, sa mga lockdowns, hindi naman makakalabas yung ating mga clients for them to get family planning services. So we need to adjust these services. We also need to improve our contact tracing. We need to have timely testing, isolation, and treatment of persons affected by COVID-19. And of course, we need to guarantee effective delivery of COVID-19 vaccines. Ngayon, nag-introduce na po tayo ng boosters for A1, A2, and A3.1. So we really need to do that and ensure that the logistics are properly in place and implemented. And then, of course, if this one is very important, kahit pre-pandemic pa lang po, we need to promote a healthy lifestyle. Kasi if you would see yung mga causes of death, karamihan po doon, yung mga top notchers aside from COVID is related to our lifestyle. So we need to continuously promote to Filipinos have to have a better lifestyle. Next slide, please. And then, of course, we need to ensure responsive and resilient health system by having strategies for people to access quality and affordable health and nutrition products and services. Yung ating pong out-of-pocket spending o yung nilalabas na pera ng mga tao when they go and get health services, it should be lower down pa. Okay, and then we need to upgrade our health facilities. Ito po, now this is being done, especially last year, bigla ang kinailangan i-upgrade yung ating health services for us to be able to respond to the needs of the COVID-19. And then we also need to improve the working conditions of our healthcare workers, including the benefits that they need to receive, especially at this time. Okay, and then improvement of epidemiological and surveillance capacities, which we should be doing not just now, but continuously in the future. So ang kasama po dyan, we need to establish and make operational yung ating level 2 biosafety laboratory in every region and stocked with adequate number of testing kits. Second, we need to utilize technology such as yung ating mga mobile applications to facilitate contact tracing, real-time surveillance, and infectious diseases. And then we are also pushing for the creation of local or regional centers for disease control. And lastly, we need to strictly implement the mandatory reporting of notifiable diseases and health events of public health concern. And that's under the Public Health Concern Act na ating pong sinusupport. Next slide po. Of course, with everything, all these strategies, kailangan natin ng financing. So we need to have sustainable, equitable health financing. We need to secure sustainable investments and ensure that resources are actually equitably distributed. How are we going to do this? We need to ensure funds also and resources to sustain the implementation of our Universal Healthcare Act, okay, and other nutrition and health sector recovery activities and programs. We also need to promote complementation of health financing among national government, local government, our development partners, and other stakeholders, kasi the government cannot do it alone. And then third, we need to ensure funding for nutrition and health sector recovery activities and programs, especially at the local and community level. Next slide po. And then for our cross-cutting strategies, we need to continuously institute the health information system and database that is connected in all facilities. And then we need to strengthen our health research and development. We need to encourage partnerships with non-government institutions and entities, and we need to ensure sector transparency, accountability, and good governance. Next slide, please. And then we need to, of course, timely monitor our progress para alam po natin for evidence policy-based making and build the trust and confidence of our stakeholders and improve our capacity for the future. So ngayon nakikita natin na maglalagang SDGs because of the monitoring that we are doing. So we need to continuously do that. Next slide po. And then we need to cooperate by having effective multilateralism and full participation of all sectors in the society. Kasi yung nasasabi ko, kailangan ng stakeholders partnership for us to be able to achieve our sustainable development goals. And it's also important that science, technology, policy, and practice will be promoted. To a certain extent, the COVID-19 pandemic actually accelerated the digital transformations of government and businesses, changing the way people actually interact, learn, and work. So as the government moves towards recovery, this will include rolling out and adapting technologies to increase its competitive edge in the digital economy. So nandiyan na po yung ating mga telehealth, consultation, etc. In summary, of course, next slide po. Despite the presence of the COVID-19 pandemic in the country, the national government actually and the local governments are doing its best to recover from the health crisis through expediting our vaccination program and employing a risk-based approach in easing restrictions and opening the economy. So hindi talaga madali yung balance po kasi ng health and opening up. But we really try our best. The updated Philippine Development Plan and other sectoral plans provide us guidance in getting through the pandemic while pursuing our strategies that will contribute in achieving this sustainable development. We at NEDA, in partnership with the other agencies and stakeholders, will continue the integration of the SDGs in the succeeding Philippine development plans. So maraming salamat po and good morning to everyone.
Thank you very much, Ms. Casimiro Igtiben. Let us proceed immediately with answering questions relayed by our audience. So we have a question here, ma'am. Are there any specific roles that universities or those in the academe can assume in the achievement or even in monitoring the achievement of our SDGs in the Philippines?
Yes, actually, the academe is one of our major partners in implementing the Sustainable Development Goals. So this year, starting the end of this year until next year, the subcommittee on SDGs is trying to call on already the other stakeholders, non-government stakeholders, for them to be able to help out. Especially the academe will be helping in developing yung may mga indicators pa kasi tayo for monitoring that is yet to be developed, yung mga methodology. And of course, providing research on how we can further improve our strategies and programs in terms of achieving the Sustainable Development Goals.
Thank you. Thank you, ma'am. Here's a question related to occupational health and safety. So where can is occupational health and safety part of our sustainable development goals? Where can we find it in, and do we have any specific indicators for it?
I think at the moment, wala siyang direct indicator for occupational health, but it is a contributing, the occupational health is a very important contributing factor to our goals on labor and health as well. So ano siya, parang intersecting sector siya dun sa major goals.
Thank you, ma'am. We got a question here from our YouTube participants. So in the economic and development perspective, what can we do to lessen the casualties of this pandemic in our country?
Actually, we have been continuously providing reskilling and retooling kasi accepted natin na yung mga unang natanggal sa labor force will have a hard time getting back to the labor force kung hindi sila marireskill and retool, because at this stage, para nagiging mas digital na yung mga needs in terms of a labor and yung mga fourth industrial revolution types of skill. So the TESDA is continuously giving out trainings. Meron tayong online trainings as well kasi kailangan natin silang reskill and retool. That's one. And then secondly, the DOLE through the pesos is trying to help out people to be connected to the available jobs in the market. So the people would just need to go to their local government unit and there may mga peso doon that they can connect them to those available jobs. And then lastly, like last year, we have been giving some subsidies kasi hindi naman din kaagad-agad makakakuha ng trabaho yung mga tao. So last year, we gave the small wage subsidy through SSS and the SAP din, yung ating social amelioration program. But of course, hindi naman yan laging frequent. The frequent one is the unemployment insurance under SSS. So those are the three things: subsidy, reskilling, and retooling, and helping them out to go back by connecting them to the pesos.
Thank you. Thank you very much for that, ma'am. Here's another question. So from a health worker working in the private sector. So they're asking what would be our recommended focus to be able to bounce back our health programs for, I'm assuming she's referring to, or they're referring to the health programs for the coming year, 2022.
Come again? Sorry, medyo nawala.
So what would be your recommended focus for us to bounce back our programs, our health programs in the coming 2022?
As mentioned, actually, yung mga last strategies na kailangan natin gawin, of course, yung mga improvement ng research capacity natin in the health sector, and then we need to implement yung ating mga local center for diseases, and then we need to continuously improve our health facilities, the capacities. Yung HRH natin also is very important, yung human resource for health natin. We need to take care really of our health workers kasi yan yung ating mga frontliners talaga in the next years, because as it is now, parang we do not know until when the COVID-19 will be here. Kaya nga we are saying that we really need to move towards living with the virus. So itong mga systems na to, katulad ng binanggit kanina Dr. How, we need to really do our best para maging prepared yung system and magpa-vaccinate yung mga tao for us to be able to really parang pa nagko-COVID ka, para ka na lang magkatrangkaso, ganyan. And then if you need to go to the hospital, mabibigay sa iyo yung services na kailangan mo. And then with the socio-economic report that we are doing at the moment, gumagawa na kami ng scenario planning, meaning ano yung mga possibilities, different scenarios that will happen in the next 2 years. And then we will be also introducing new strategies for us to be able to be prepared for that. Kasi yun yung nawala. Pre-pandemic kasi parang nagulat tayong lahat when it happened kasi hindi pa na-institute yung future planning and scenario building. So that is what we are currently doing. The NEDA and the DOH actually already, I know DOH also have the future planning already. So yun yung mga ginagawa natin at the moment.
Thank you, ma'am. Here's a private question sent to me. So what are the views, perhaps no, on an economic and development perspective, what are the views for or future employment no, for the unvaccinated ones, no, especially with the resolutions getting stricter no, for those who remain unvaccinated?
Actually, we are encouraging people to be vaccinated kasi yung hesitancy actually bumaba naman eh. I think according to SecVince, it's already at 18%. And based on a study done by UNDP, yung hesitancy comes from number 1, yung mga fake news na kumakalat. Number 2, yung preference for vaccine. Yung ating pong preference for vaccine, medyo nasasagot na natin ngayon yan kasi people really, of course, accepted na natin. Most of the people prefer Pfizer, Moderna, and those are the vaccines naman that are really available at the moment. That's why we are encouraging, especially those who are working na magpa-vaccinate na, because it doesn't just protect you, it also protects your family, yung mga taong nakakasalumuha mo sa office. Kumbaga, yun yung sinasabi kanina na cocoon eh. It will benefit not just you, but everyone. So we are really appealing sa ating workers to get vaccinated.
Thank you. Thank you for that, ma'am. So this is a question related to our ongoing remote blended learning. So how do we see it impacting our future labor workforce? No, with school being delivered remotely for our basic education and for our tertiary education levels.
Actually, yung face-to-face learning NEDA is supporting the return to in-person learning, because you know what, based on the computations that we did, yung ating mga bata, because of the mode of learning that they are having now, yung module and online learning, yung online learning kasi they just got 50% lang nung usual nilang nakukuha compared to in-person learning. So kapag nangyari yan, meron kang around 11 trillion na losses na mangyayari sa mga bata natin as computed. So importante talaga na yung learning loss na yon, hindi man natin, kasi hindi man natin yan talaga fully mababawi. Pero sana yung ma-half man lang natin yung learning loss na yon by getting them back to school. And also, mag-ramp up tayo ng iba pang strategies. Like now we are looking at tutors or yung mga additional help para makuha pa yung naiwan na learning losses ng mga bata. And itong face-to-face learning that started last November 16, so far we are getting good feedback. Maayos naman, and as of now, wala pa namang reports of any cases sa ating mga schools at the moment. Kasi I just like to inform everyone that before DepEd and implemented this, there have been, may model yan na ginagawa with EOH and the UNICEF. So, tinitingnan yung cases sa area and everything. So, hindi basta-bastang ginugo yung mga schools, and then the schools have to be prepared. Meron dapat minimum public health standards na ini-implement, and the facilities is really ready. Yung ventilation is okay and everything is okay. And then the monitoring. Yun. So, yun talaga. Kasi nga, malaki magiging effects sa ating labor force pag hindi pa natin sila binalik talaga sa schools.
Thank you, ma'am. I guess this would be the last question for this portion. Is there a program to roll out the SDGs to relevant stakeholders such as local private companies? Let's say, for those in the manufacturing industry, for some multinational companies, applicable SDGs are already included in their corporate goals. So hence, they can help in the achievement of our SDGs.
Actually, pre-pandemic, we've started already rolling out the SDGs in the private sector. So we have been receiving requests for orientation and on how they can help out. And then ng SEC, ang Security Exchange Commission, they have already a reporting for the businesses in terms of the sustainable development goals. So kasama na yun sa reporting nila. So that is one way for the sector, the private sector, to be also helping out in terms of achieving our sustainable development goals. If there are companies, kasi nga yung multinational, mabilis silang mag-adjust, but if there are small companies or some other companies who would want to know more about the SDGs, how they can help, they can easily, they can go to NEDA's website on the SDGs and then send us a message, and then we will be happy and gladly help them out on how they're going to do it at their own businesses.
Thank you very much, Ms. Casimiro Ectiben. So that was a very good strategy. So we can reinforce the public and even the private sector to really contribute to achieving our sustainable development goals. So thank you everyone for that very engaging discussion. So we received a lot of questions and we were able to cover all of them. We would like to thank our speaker, Ms. Girly Grace J. Casimiro Ictiben of the National Economic and Development Authority Social Development Staff by awarding the Certificate of Appreciation. The certificate reads, College of Public Health, University of the Philippines, Manila, CMEO-TROPMED Regional Center for Public Health, Hospital Administration, Environmental, and Occupational Health awards the Certificate of Appreciation to Ms. Girly Grace Casimiro Ictiben for her invaluable contribution by sharing her expertise as resource person during the 4th National Environmental and Occupational Health Forum conducted by the Department of Environmental and Occupational Health, done remotely from the College of Public Health, University of the Philippines, Manila, on 25th and 26th November 2021. Given this 26th day of November in the year 2021 in the city of Manila, Philippines. Signed by Dr. Paul Michael R. Hernandez, our department chair and overall forum coordinator, Dr. Fernando B. Garcia Jr., Assistant to the Dean for Planning and Development, and Dr. Vicente Y. Belisario Jr., Dean and Center Director.
Thank you. Thank you also so much, and it's always happy to be back sa aking alma mater. Thank you. Thank you very much.
Maraming salamat po. And thank you to our excellent speaker for our concluding lecture, Achieving SDGs in the Post-COVID Era. I would like to return the command of the virtual floor to our Master of Ceremonies, Professor Abby Duarte. This has been your moderator, Harvey. Good morning to everyone.
Thank you so much, Sir Harvey, for facilitating the previous session. And thank you also to our speaker. And at this point, we'd like to express our sincerest gratitude, our sincerest thanks to all the speakers who graced this day's event. Thank you to Dr. Jason Ligot, Health Promotion and Communications Consultant of WHO, to Dr. Razel Nikahao, OIC Director 3 of DPCB Department of Health, and to Ms. Girly Grace Casimiro Igtiben, OIC Director, Social Development Staff, National Economic Development Authority. We are so pleased to have all of you. To our participants, we value your feedback and would very much love to hear from you. So please accomplish the evaluation forms for yesterday and for today. The link will be shared by our staff. And for you to receive your certificates of attendance, please make sure that you accomplish both evaluation forms as well as the short post test. The link for the eval form and the post test will also be shared by our staff and will be emailed to the registrants immediately after the event. And you are allowed to accomplish the forms only until 3 o'clock today. So please make sure to make it in time. And also about the materials used by our resource persons, we'll make sure that you'll be able to download them through an official Google folder. This folder will be shared to you via email at the end of the forum. And it will be accessible until November 25, 2022. So you have 1 year to revisit these files. Okay, so just await for the announcements and the links to be shared through the chat box. Okay, now to officially conclude our two-day forum, a very productive two-day event, I would like now to invite the department chair and the overall coordinator of this event, Dr. Paul Michael R. Hernandez, to share his closing remarks. Over to you, Dr. Hernandez.
Thank you, Prof. Abby. Good morning, everyone. Our sincerest gratitude to our distinguished speakers for their excellent presentations and inputs during our fourth Environmental and Occupational Health Forum. We had Dr. Memon, Dr. Singh Vergere, Attorney Bathan Baterina, Mr. San Pascual, and today Dr. Ligot, Dr. Hao, and Ms. Casimiro Itiben. The discussions on environmental and occupational health systems truly made us aware of the urgency in addressing these challenges and how we can contribute in responding to these concerns, and eventually ensure that we become more responsive and resilient for the next global crisis. A big thanks to the 14 strong ladies and gentlemen joining me in the department for their contributions in planning and conducting this fourth offering and incidentally, the second virtual offering. Special thanks to Dr. Camacho, Dr. Molina, Professor Manalang, Professor Duarte, and Mr. Domingo for effectively guiding us in the discussions. Equally important contributions are those at the background. We have Dr. Estrada, Professor Lomboy, and Professor Quizon. Thank you also to our support staff, Sir Dex Tiro, Ms. Heidi Mike, Sir Ian Agravante, Ms. May Bass, Mr. John Bayatan, and Ms. Che Ramos. So everybody now knows how many should run an event as big as this. Thank you again to my EOH family. Thank you also for the support of the College of Public Health Administration, led by Dean June Belisario Jr., and the entire University of the Philippines, Manila, led by Chancellor Carmencita Padilla. We are overwhelmed with the outcome of this event. Hundreds of participants, reaching as high as around 450, contributing numerous questions and insights, plus multiple social media interactions. We have attendees all over the Philippines with a few abroad, including those from fellow CIMEO centers. We appreciate everyone for joining this annual offering. Please note that our discussions should not end upon the conclusion of this forum. Let us continue to talk about EOH among our peers, engage our policy makers and leaders, and protect the environment. As shared by Ms. Casimiro Itiben earlier, we need to synergize our efforts to ensure good health and well-being. We hope to have a healthy and resilient Philippines. The Department of Environmental and Occupational Health is committed to conducting teaching, research, and public service activities. We invite everyone to join our 2 academic programs, so kindly choose one: Master of Science in Public Health, Environmental Health track, and Master of Occupational Health. We hope to see everyone in future DEOH events, especially at the 5th EOH Forum in November 2022, or in our graduate classes. Do not hesitate to contact us through our different communication channels. Please stay healthy and safe. Have a great day, everyone. Back to you, Prof. Abby.
Maraming salamat, Doc PM. Thank you for sharing that inspiring message. And to everyone, we sincerely hope and pray that for the 5th Environmental and Occupational Health Forum, we'll be able to see you again. That will be on November 25 to 26, 2022. So please mark your calendars already. And we are not sure yet if it will be virtual or if we will see each other face to face. Let's hope for the best, but we hope that all of you will stay healthy and safe. So this has been your Day 2 Master of Ceremonies, Abby Duarte. Thank you so much for joining us and for seeing through this event with us. Thank you so much and have a great day ahead. Enjoy your weekend. Thank you, everyone.